As children and teens head back to school, they'll be doing more than just homework and studying. Many students will participate in fall sports, everything from football and soccer to cheerleading and volleyball. These activities often generate excitement for both students and parents. However, they can turn from fun to dangerous in just a moment's time if injuries, specifically head injuries, are not properly diagnosed and treated. Here's Dr. Stephen Flaherty, Trauma Medical Director at Del Sol Medical Center, to explain what parents should look for to ensure that students and student athletes stay safe.
Now that school gets back in session and our student athletes get back into athletics, whether it be football, volleyball, soccer, there's unfortunately opportunities for them to experience concussion. It's very important for everybody to know what the signs and symptoms are so that we can provide the earliest help needed if a concussion has occurred. A student athlete who has experienced concussion might demonstrate nausea and vomiting. They might have experienced loss of consciousness, probably briefly. They might have bad headache that's worsened by either light or sound, and they might be acting abnormally in the way that they're thinking and behaving. When a concussion goes unrecognized, it places the student athlete at some risk for a worsened experience with another concussion. We want to make sure they've had a good evaluation and treatment and recovery period from any concussion before they risk getting a second concussion. An unrecognized concussion also puts the student athlete at risk for a prolonged recovery because they're not getting the help they need and the support to appropriately heal and improve from that first injury. A student athlete who has experienced brief loss of consciousness from being struck in the head should absolutely seek medical attention. If an athlete experiences unusual headaches or has nausea and vomiting that is new and different, that should also prompt them to seek medical assistance. And if the parent were to notice that the student is doing worse in school, is having difficulty concentrating on assignments, then that would be a good reason to either see your pediatrician, primary care doctor, or seek assistance in an emergency room.